Good morning, everyone. I hope you all are doing well.
Good morning, sir.
Good morning.
Good morning. So, today, this is our first class of counseling psychology. So, do you have any idea about counseling psychology? Anyone? Have you heard about counseling psychology? Because counseling psychology is one of the area or specialization within the psychology. Okay, I'll tell you. Basically, counseling psychology in general, we can say it's a mental health service special, which is a spatially in which the professional who is in psychology is use a broad range of culturally informed or culturally sensitive practices towards the people who are in need, basically, or who want to improve their psychological well-being, or who want to overcome from their distress or maladjustment, or who want to resolve their crisis. So in counseling psychology, you can say the psychologist or a counseling professional use different skills and procedures like individual therapy, in family therapy, group counseling, crisis intervention, trauma management. We do have assessments in counseling psychology to diagnose the psychological issues. We do have programs, workshop to educate the community, or we could, I will say, the inform the community or to mobilize the community about the mental health, schools, families, relationship, workplaces. In counseling psychology, we do train the other people. We do have a provision of clinical supervision. In counseling psychology, we do construct a psychological test. We use different scientific investigation methods to conduct research. Okay, what is counseling? We'll start from here. What is counseling? Anybody wants to say anything about counseling? What do you understand by counseling? आप क्या समझते हैं काउंसलिंग से? काउंसलिंग क्या है?
सर
Sir,
जो भी क्लाइंट
sorry.
वन बाय वन. यस, पूजा बताए.
जो भी क्लाइंट होते हैं उनकी प्रॉब्लम सुनना, ठीक है, एंड देन हमें उसका सॉल्यूशन निकालना, मे बी काउंसलिंग।
ओके, क्लाइंट्स की प्रॉब्लम सुनना और उसका सॉल्यूशन देना. ओके.
हाँ, लाइक स्ट्रेस हो गया, डिप्रेशन हो गया, एंजाइटी हो गई। अगर कोई बड़ा है, अगर कोई बच्चा है तो उनसे कि उनको भूख नहीं लगती व्हाटएवर, या पढ़ाई में मन नहीं लगता शायद।
ठीक है. अनु, आपका क्या कहना है इस बारे में?
So, like we discuss our career prospect in career counseling and other kind of counseling in school, like adolescent, we guide them or we discuss issues with adolescent. This
राइट.
this is done in counseling sessions.
Yeah, in counseling, we the professional usually also emphasizes on the uh, educational and the vocational part of the adolescents with adults. So basically, we would say counseling is a like a helping relationship, which includes someone who is seeking help and someone who is willing to give help, right? And especially the person who is giving help is capable of, or you can say, a trained for helping and work in a particular setting that permits him or her to help the other person, or the person who want to receive help, or the recipient. Or in a simple term, we can say that counseling is an interactive process which is characterized by unique relationship between the counselor and the client, which lead to changes in the client's overt behavior. Overt behavior means uske actions, scoping skills, decision making skills, relationship skills, and his belief system, the way he thinks, the way he uh, choose things, what he believe about himself or herself or the others, and how he perceive the entire world. So the counseling psychologist works on different parameters of the client. And to become a counselor, you may require professional training under the supervision of a, let's say, competent and experienced counselor. I would just hold on. I have a PPT and I'll share Can you see this? A P-
Yes.
Yes, sir.
Yes.
right. And people also have many misconceptions about the counseling process. Sometimes people may think it is a kind of activity in which uh, a professional provide information, provide advice, or maybe the person interviewing the other person. And sometimes people also may think that the counselor is or the counseling process is used to select people for a right job, which is very much appears similar to the counseling, but this is not the counseling at all, because in real life counseling is done in a very systematic way, or you can say it is a very systematic intervention in the life of the person who is willing to seek help. There are some elements of counseling. As I mentioned, it is a voluntary process in which a counselor respond to the feelings, thoughts, actions of the client. Apart from it, it is very important the acceptance of the client's perceptions and the feeling. Another important element of the counseling process is the entire setting of the counseling, which should maintain the confidentiality and the privacy. And the counselor focus on attention uh, on the specific problem of the client. Do you think that uh, counseling and psychotherapy is the same thing, or it is a different phenomena? Because in many times we use both the terms interchangeably, counseling and psychotherapy, but they both are entirely different, or they both do differ from each other. Any idea what is psychotherapy?
Sir, psychotherapy is, I think, related to psychodimensional school of thought, and they also जो उनका रूट कोज होता है अनकॉन्शियस माइंड में, कॉन्शियस और सबकॉन्शियस में, अनकॉन्शियस में, दे उसमें उसको स्टडी करते हैं। यानी कि आपने भी लिखा है उसमें रूट्स को, जो हमारे अनकॉन्शियस माइंड में, सबकॉन्शियस माइंड में जो हमारी वो सब प्रोसेसेस होते हैं उनको एक्सप्लोर करते हैं।
Mm-hmm.
और काउंसलिंग इज अबाउट जनरल इंटरेक्टिव प्रोसेस। it is also counseling related to our career, or it is related to our behavioral issues, or maybe related to cognitive issues. Sir, I think this is the difference.
Yeah, to some extent, right? Yes, as I mentioned in the PPT also, counseling basically as an interactive and a voluntary process, and which in general refers to a very short-term consultation with the counselor. And the counseling processes uh, majorly focuses on the current issues, present problems. Counseling, or you can say the counseling processes basically try to help out the client in terms of their uh, maladjustment issues, stress, anxiety, coping mechanism, conflict in the relationship, difficulty in taking decisions, managing the conflict at home, at workplace. But psychotherapy is entirely different phenomena from the counseling, because psychotherapy, when we say psychotherapy, psychotherapy is a long term process or long term intervention, basically intervention towards to deal with the mental disorders, mental health disorders. And psychotherapies are very intensive. Intensive, what do you mean by intensive? When I'm saying psychotherapies are very intensive in nature.
Sir, as these issues require individual to get into the depth of uh, any problem, and it is a long-term treatment, probably with the suffering of the other person. It creates an impact on the person who's doing the psychotherapy, and hence probably the process is intense.
Yes, the process is very intensive because in psychotherapies, we do have a mental state examination. We do have case studies, in which the counselor seeks the entire information since from the childhood of the client till the present age. Because as in the last slide, you have shared one thing. It focuses on the roots of the problem, or it follows the psychodynamic approach. Psychodynamic approach क्या कहता है? The root cause of all the problems exists in the childhood issues. So in psychotherapy, the counselor or the psychologist trying to identify the issues which are happened in the child. Okay. Do you think there are any gain of counseling process for the client? Suppose there is a person who is in depression, or maybe having an issue of adjustment at a in school. So do you think that if a counselor counsel the person, is there any sort of benefits to the particular client.
Can I speak, sir?
Yes, yes.
Yeah, Ramandeep this side.
Huh.
Sir, definitely there is lot of benefit in school counseling. I have seen myself. There are children who are not able to cope up in class, and many a times, and there's lot of improvement we have seen in children by the counseling sessions that are given, especially by the counselors in school.
Right. See, most important gain of the counseling, basically the first, the owning of the problem. Secondly, I would say that developing, the person will develop the understanding of the problem. Or once you understand the problem, definitely you will acquire new behavior, new actions to solve that problem. And lastly, developing effective relationships. When I'm saying owning the problem, it means the client is able to accept or accept the responsibility for his or her problems, right?
Right, sir. Actually, accepting is the basic. I feel acceptance is very difficult. Once the acceptance comes, then the whole process starts.
Right.
Otherwise, when acceptance is not there, that has the child has the problem. Acceptance from parent side, or acceptance if the child is small. If he is little, grown up, can acceptance can be from his own side. So when acceptance is there, then only we can start with the process of, we can
Counseling.
work on it.
Definitely. See, without acceptance, we can't do anything because client come for a counseling and they start blaming people or environmental factors for their problems. So owning the problem is a first step towards the solving the issue. If you accept that you are responsible for the problem, because we are responsible for our own actions, right? If we accept that there is a problem, then only we can solve it. Then we have to understand the problem. We have to take the responsibility of the problem. When you take the responsibility, definitely you will get an insight into the problems, and this insight basically help you to control over your reactions to the problem. And once you develop the understanding of the problem, you will acquire new behavior. You will start behaving in a different manner. आप अपने आप को बदलते हैं, आप अपने आप को चेंज करते हैं. You change your own behavior to deal with the situation. और इन सब चीजों से क्या होता है, once you start changing your behavior, then definitely the things will become better and better. So where we need counseling, especially these are some of the problems where we need counseling, like in career, in vocation, in like trauma management, grief situation, anxiety, depression, problem with adjustment, especially with the partner or the family, parent-child relationship, school issues, sibling relationship, divorced parents, learning disabilities among the children, ADHD problem, marriage conflicts. And I think uh, in today's arena, the need of the counselor is becoming or growing, I would say, growing more and more, because these are the problems which are very much vigilant in the society. वरना पहले ये सब सारी प्रॉब्लम्स कहाँ दिखती थी. Problems tab bhi thi, but now because of the technology, because of the social media, now problems are very much vigilant in the society. Problems are very much uh, even the people now acknowledge that there are some mental health issues. We require a counseling. We need a psychologist. We should have psychotherapy. So people are acknowledging the fact. Who would be the counselor? Hmm? What are the qualities of a counselor? A good counselor,
He should be a good listener.
right? First of all, he should be a very good listener,
So patience.
patience,
Good
Should
analytical
be
skills.
honest, warm person, and should be able to non-judgmental and respectful. Being respectful is also very important.
right?
So उनका
And
communication
empathy
skill भी
also. I
better
must
होना
say,
चाहिए.
empathy should be there in that person.
Empathy should be there, right?
So patient listening is required.
Okay. Patience and
And understanding.
So good
understanding. Okay.
communication skills, good communication skills.
Good communication skills, right? Mhm. See, in counseling process, the client and the counselor both work together towards the desired outcomes, right? So the counselor who is a trained helper, he or she ensure that the client will or should benefits. So in order to become an effective counselor, you must develop some qualities, because you all are a student of counseling psychology, so you should have those qualities. So the first and the basic important
मैंने कम कर
quality,
दिया मैं कम कर दिया मैंने अभी कम किया मैं तो थोड़ा बहुत टेस्ट करके थोड़ा मैंने भी टेस्ट किया मैं साइड से थोड़ा
क्या क्वालिटी होनी चाहिए? द काउंसलर शुड aware and have understanding of one's own self, right? सबसे पहले काउंसलर को वो खुद सेल्फ अवेयर होना चाहिए, उसको खुद की अंडरस्टैंडिंग होनी चाहिए. If I'm a counselor, then I should know what my needs, my feelings, my personal strength, my limitations, and this will help me as a counselor to understand themselves, or like you in terms of मैं बात करूं myself sufficiently. If a person coming to seek help from me, then I definitely, my strength, my limitations will help me out to understand what other is, like what the other person is looking for, so I can connect with the client more efficiently. Second important thing is, you must be in a good psychological health. If you are a counselor, your psychological health is equally important. होना चाहिए कि नहीं होना चाहिए?
Yes, so
If you are not in a good psychological shape, then how would you help the other person who are in need of psychological help? Definitely your problems will start distracting you from the others. You should be very sensitive. Another important quality, you should be very sensitive. Sensitive in terms of culture, sensitive in terms of gender. You should be open minded. You should respect the feelings, values of the other person. You should maintain the objectivity. There's no scope of biasness. There's no scope of judgmental attitude. You should respect the other person. You should be a good listener, right? But you should be very, you should have the attentiveness. Lastly, I would say you should एम्पैथी. किसी ने मेंशन किया था कि एम्पैथी होना बहुत जरूरी है. What do you mean by empathy?
To put someone in other shoes, like to see the other person who is taking the counseling from the counselor,
Mm-hmm.
to put himself in the other person condition. If I was there, then what would I like to have?
Okay, right. So basically, empathy involves sensitivity to the client's problem and being able to see things the way the client does. Right? So basically, the empathy involves perceiving and communicating. Perceiving in sense, it means like it's an intense process of active listening by the counselor. You should
So
put
can we put sympathy in this category also in the
sim-
characteristics?
no. Sympathy is something else, and empathy is something else. Empathy, you are trying to understand the other's perspective. You are seeing the world from his or her own eyes.
Okay, sir. Thank you.
So there are different types of counseling processes, or you can say approaches. There's a directive counseling approach, non-directive counseling approach, eclectic approach. इसको हम बाद में पढ़ेंगे. अच्छे. So what is involved in the counseling process? So these are a few points which are equally important. What interactive relationship, collaboration between both the parties, like from the counselor and from the client, set of clinical skills and techniques which are required by the counselor to work on the desired outcomes as required by the client. Positive reinforcement. Positive reinforcement is equally important in the process of counseling process. In the whole counseling process, it is mandate from the counselor to motivate or to give positive reinforcement throughout the counseling process. Providing emotional support throughout the counseling process. And it is the duty of the counselor to maintain the formal records about all the issues, problems shared by the client. And one important thing, never use the word patient. Use the word client. Okay. So these are important ethical codes in counseling, because ethics are equally important in counseling process. Counselor should have knowledge about the ethical issues which are involved in the profession of counseling, because in counseling there are some legal implications too. So there are subsets. These are the subsections of ethical codes, like about the counseling relationship, about the confidentiality and privacy, professional responsibility, relationship with other professions, evaluation, assessment, interpretation, supervision, training and teaching, research and publication, resolving ethical issues. Okay, so there are different sections about the ethical, but there are important ethical codes. What are they? Hmm? Any idea?
Sir, kindly repeat the question.
What are the ethical, or what are the ethical, uh, I would say ethical codes or ethical things which are
Uh,
very important in counseling process, which should
Sir,
be?
to keep the information of the client confidential.
Yes. First,
Like,
confidentiality, because in counseling process, counselor are ethically obliged to keep the information of the client confidential.
Yeah, confidentiality is very important. Then non-judgmentalism, being
Yes,
non-judgmental is very important.
right. Because see, when I'm saying keeping the information of the client confidential, it means the counselor should not talk to anyone about the client's problem without prior permission from the client. The counselor need to take prior permission or the recent written consent from the client to share his or her problem or issues at any platform. If the counselor, if you, or as a counselor, if you want to record the relevant information about the issues of the client, so for that also you need to take, or you need to obtain the permission from the client before recording anything. So confidentiality is very much important. Another is professional disclosure. When I'm saying professional disclosure, it means a counselor must represent his or her professional qualification and experience correctly to the client. Because nowadays I'm seeing most of the counselors are not qualified, or they do not meet the criteria of counselor, but still they are practicing counseling. Professional disclosure basically contains the counselor background, training, qualification, even your fee and your area of specialization. So you need to represent all these things before the counseling process start. Then the professional relationship, another important, another ethical. प्रोफेशनल रिलेशनशिप का क्या मतलब है? व्हाट डू यू मीन बाय प्रोफेशनल रिलेशनशिप?
Sir, the counselor should not be attached emotionally, personally attached to the client. Secondly, the counselor should not be subjective; he should be objective. So, I think this is a professional relationship. Matlab, these all things contain the professional relationship, that he should not disclose the information to others. He should be non-judgmental. So these are all covered under the professional relationship.
A client
Right.
should not
Professional.
be forced to get information.
Yeah, right. See, professional relationship का मतलब होता है counselor need to respect and protect their client. Means counselor should not engage in any other kind of relationship with the client. You getting my point?
Yes, sir.
Yes,
Yes.
yes, sir.
That could doubt the counselor objectivity or judgment and interface with the therapeutic process. And the last important ethical concern is referral and termination. Because counselor must also protect the clients while making referrals or termination of the counseling process. And these situations must be handled with very sensitively. Suppose you are a counselor, and if you are not able to handle the client's problem, or you are not qualified to handle the client's problem, then you should refer that client to the competent and the qualified counselor. It is your duty, you are ethically bound to make a referral in that case. अब ये नहीं कि जबरदस्ती बस खींचे जा रहे हैं खींचे जा रहे हैं खींचे जा रहे हैं just to make money. No. If you are not able to handle the client issues or problem, or you are not competent enough, or you are not qualified for doing therapies or the assessments and all, you should refer the client to the competent person. You are ethically bound to do that. And lastly, the counselor should discuss with the client about the termination of the counseling in advance to the actual termination, like while terminating the counseling process in advance, before, like if you are into a 8 session or 10 session, so before the 8th session, like around the 6th session of the counseling process, you should start, or you should inform the client about the termination of the counseling process. Even in the counseling, there is a very much important ethical concerns about the evaluation assessments. As a psychologist, or as a student of psychology, or as a counselor, you should take you need to take the informed consent. You need to use standardized psychological test. When I'm saying standardized psychological test, it means the test should have reliability, validity, and norms. And you should maintain these standardized condition while administering the test. And it is equally important to select the test, or which test is suitable for the particular problem. That is also depend upon your qualification and your experiences. Okay. So there are some theoretical approaches behind the counseling processes, because behind every research there is a philosophy. So even behind the counseling psychology or the counseling processes, there's the philosophical roots. Majorly affective approach, behavioral approach, and cognitive approach. If I'm saying affective approach, person-centered therapy, gestalt therapy, body awareness therapy, psychodynamic therapy, or experiential therapy. When I'm saying behavioral approach, behavioral therapy, reality therapy, cognitive behavioral therapy, cognitive approach, rational emotive therapy, information giving therapy, problem solving, transaction analysis. इनको हम पढ़ेंगे बाद में, हमारे बाकी यूनिट्स में हैं ये, नेक्स्ट सेशंस में आएंगे सारे अप्रोचेस. एंड दिस इज द काउंसलिंग प्रोसेस. Like step initially you need to establish the rapport, assessment, setting goal, intervention, then termination and follow up. Okay, this is all about the first model of the counseling processes. If you have anything in your mind, so please come up with your questions. So this is the basic introduction about the counseling processes. If you have anything in your mind, so please, your concern, your issues, आप पूछ सकते हैं.
सर जैसे हमने अभी डिस्कस किया कॉन्फिडेंशियलिटी, सर उसको थोड़ा सा एक्सप्लेन कर सकते हैं, क्योंकि जैसे हम अभी इंटर्नशिप कर रहे हैं तो हमारे जो काउंसलर हैं जिसके भी अंडर हम कर रहे हैं वो केसेस के बारे में हमें बताते हैं, हम तो फिर वो क्या उनकी कॉन्फिडेंशियलिटी हर्ट नहीं कर रहे हैं?
बिल्कुल हो रहा है.
हो रहा है.
sharing the information about the client's problem, client issues, this is what we call the breaching of confidentiality. If until unless the counselor already have been taken the permission from the client to share his or her information with the interns. जैसे कभी कभी क्या होता है कि आप लोग सपोज यू आर गोइंग फॉर अ इंटर्नशिप एंड द काउंसलर अलाउ यू टू सिट इन द रूम, द काउंसलिंग रूम जहाँ पे काउंसलिंग चल रही होती है. सो वो it is a mandate to ask the client before you will enter into the room. The counselor will ask कि हम अपने interns को क्या यहाँ बिठा सकते हैं. If he or she allows, then only you can attend the counseling process.
And sir, also sometimes when like some counselor is sharing the information to others, they used to, matlab, suppose for example you are telling us about any case study, so normally the teacher or the counselor changes the names and places and all these information of the clients.
Right. ये हम लोग यूज करते हैं because just to maintain the confidentiality, we counselors or the teaching, yes, even educators, you change the name, place, everything.
And sir, also if we are doing some type of research and we are taking information, we are taking interview from the clients, and we also change the name and their locations and all these things so that the confidentiality can be maintained in that.
बिल्कुल कर सकते हैं आप. See, if you're using that research in terms of publication, in terms of like using that information at any platform, in that case you can hide the information or demographic details of the client and you can use the other information to share with others.
Yes, sir.
और सर जैसे कुछ सेशंस होते हैं या फिर कुछ क्लाइंट ऐसे होते हैं जो सिर्फ फोन पे ही सेशंस लेते हैं, तो सर उनके साथ भी तो डील करना बहुत मुश्किल हो जाता है, क्योंकि एक तो फेस टू फेस हम उनको ऑब्जर्व कर सकते हैं बहुत सारी चीजें वो जब बोल रहे हैं या कुछ ऐसा, लेकिन फोन पे हम कैसे फिर उनको मतलब कैसे डील करेंगे उनके साथ?
See, online counseling process, although it is a very difficult process, but nowadays people don't want to visit the counselors. They because आजकल easy है ना बहुत, कि हम लोग फोन पे बात कर लेते हैं और फोन पे हमें बता दीजिए ठीक है आप प्रोसेस कर लीजिए, बट ऐसा हो नहीं पाता. इट्स वेरी डिफिकल्ट. से इट्स योर ड्यूटी टू give a sound argument so that they can turn up to the a particular place where you can give counseling process or counseling thing. Because आप फोन पे हर चीज सारी चीजें आप क्लियरली नहीं बता सकते हैं, नहीं बोल सकते हैं, एंड बिकॉज देयर आर सम लिटिल समटाइम्स सम बाउंडेशंस आल्सो.
And sir, if there is online counseling, तो phone की जगह I think like Zoom platform, Google Meet, जिनमें face to face you can see each other. तो जब face to face हम एक दूसरे suppose the like client is telling us something, तो we can also see the expressions of the client. We can note down the behavior of the client. तो वो भी बहुत important है. यदि online ही करनी है तो कम से कम एक दूसरे का face तो देख सकें.
सी ऑनलाइन में देखिए, ऑनलाइन ऑनलाइन है. सी अगर मैं बात करूंगी, एक क्लासरूम टीचिंग है और एक ऑनलाइन टीचिंग है, दोनों में बहुत जमीन आसमान का अंतर है.
क्लाइंट अपना फेस रिवील नहीं कर पाते हैं, मतलब वो एक्सेप्ट नहीं करने को, वो नहीं है कि भाई सोसाइटी में हमारा नाम हो जाएगा कि हाँ इसे काउंसलिंग की जरूरत पड़ रही है, वो इसीलिए तो ऑनलाइन ले रहे हैं. एडमिट करना भी तो बहुत मुश्किल हो जाता है लोगों के लिए कि काउंसलिंग नॉर्मल है, उनके लिए तो बहुत ऐसा तो जैसे कुछ बीमारी होगी है उनको.
सी स्टिल राइट.
बिल्कुल एक्सेप्ट
अभी
हाँ
भी
ये
मतलब
लोग
अभी
समझते
भी
हैं.
ये बहुत बड़ा टैबू है. पीपल लोग उसको उस तरीके से नहीं देखते हैं.
सर काउंसलिंग में हम डायग्नोसिस मतलब कर सकते हैं, ऐसे
क्या चीज?
डायग्नोस कर सकते हैं काउंसलिंग प्रोसेस में? ज्यादातर जो क्लिनिकल्स वाले होते हैं वो कहते हैं कि वो डायग्नोस कोई प्रॉब्लम हो तो वही कर सकते हैं.
देखिए आप डायग्नोस अब जब बात करते हैं डायग्नोस की या प्रोग्नोसिस की, अगर आप एलिजिबल हैं डायग्नोस करने के लिए तो आप डायग्नोस कर सकते हैं. ठीक है, आफ्टर डूइंग मास्टर्स you are not eligible to do diagnosis. You should have in it, suppose like in India RCI is a autonomous body which provide license.
सर आफ्टर आरसीआई लाइसेंस के बाद ही हम लोग डायग्नोस कर सकते हैं?
Right after once you get the RCI license you can able to see the client or you can diagnose. You're eligible to use such a certain test. अब आप ये बोले मैंने मास्टर्स कर लिया है तो अब मैं साइकोलॉजिस्ट हूँ या मैं काउंसलर हूँ, ऐसा नहीं कि लोग नहीं है, लोग करते हैं, बट एथिकली दैट इज नॉट राइट.
और सर जब अगर कोई कोई डायग्नोसिस बनाते हैं लाइक हम, तो ये क्लाइंट को बताएं कि उन्हें एंजाइटी है या डिप्रेशन है, ये उनको बता सा मतलब कंपलसरी होता है?
नहीं, बिल्कुल बताते हैं ना. वंस यू डायग्नोज द प्रॉब्लम डेफिनेटली विल रिवील द इशू अगेंस्ट द क्लाइंट कि आपको ये प्रॉब्लम है और इस पे फिर हमारा ये प्लान है और इस पे हम इस तरीके से काम करेंगे.
ओके सर, कई बार होता है ना क्लाइंट तो आजकल जैसे गूगल वगैरह सब करके और फिर वो सब कुछ वहां से अलग अलग इंफॉर्मेशन लेके आते हैं एंड देन वो बोलते हैं कि नहीं ऐसा नहीं, ऐसे हमने गूगल किया था और ये वो.
तो ठीक है, अगर गूगल करके ही सब चीज ठीक हो जाएंगे तो ठीक है, फिर मतलब यू कैन डायरेक्टली से ठीक है आप गूगल करके ठीक हो जाओ.
तो सर कई बार ये ऐसा आता है कि फिर वो करने लग जाते हैं तो फिर वो आके बोलते हैं कि नहीं हमने तो ऐसा किया था, इसमें ऐसा हो सकता है, या फिर कभी और ज्यादा कुछ उसमें देख लेते हैं तो हमें ऐसा हम ठीक होंगे या नहीं होंगे.
यस यस, क्लाइंट मतलब फर्स्ट मीटिंग में ही आते साथ बोलता है कि मुझे तो डिप्रेशन है.
मतलब खुद ही अपना सब आजकल देख के
गूगल सिम्टम्स वगैरह रीड आउट करके बस अपने ऊपर अप्लाई करके कि हाँ जी हमें तो डिप्रेशन है, हमें ठीक कर दो.
हाँ, बहुत लोग बिल्कुल डेफिनेटली मैं मना नहीं कर रहा हूँ, आजकल ऐसा होता होगा ना. बट आपको ये सब चीजें यही आपका एक्सपीरियंस, आपकी क्वालिफिकेशन यही काम आती है कि हाउ यू आर हैंडलिंग सच केसेस एंड सच इश्यूज. तो आप लोग अपना यूनिट, आपका जो मॉडल 1 है, इंट्रोडक्शन टू काउंसलिंग साइकोलॉजी, वो आप पढ़िए अच्छे से. आपको कुछ प्रॉब्लम आती है तो देन वी कैन डिस्कस इट इन द नेक्स्ट क्लास.
गुड मॉर्निंग सर.
गुड मॉर्निंग.
सर मेरा एक डाउट था इंटर्नशिप से रिलेटेड, अगर मैं पूछ सकूं तो आपसे.
हाँ हाँ बिल्कुल पूछिए सर.
सर मैं दिल्ली गवर्नमेंट में एज ए साइंस टीचर हूं सर. मैं एक ईवीजीसी के अंडर में करना चाह रहा हूं मेरी इंटर्नशिप.
एवीजीसी मतलब ये आपका जो स्कूल में काउंसलर होते हैं उनके अंडर
जी
में?
सर, जी सर, हाँ जी, जी जी सर.
एमसीडी स्कूल्स में जो काउंसलर होते हैं?
जी सर, मेरी दिल्ली गवर्नमेंट की स्कूल है, सीनियर सेकेंडरी स्कूल. उसी में जो मॉर्निंग शिफ्ट में काउंसलर है, लेकिन वो गर्ल्स स्कूल है सर.
हाँ हाँ.
तो अगर मैं उसमें इंटर्नशिप करता हूँ तो उसमें कोई दिक्कत है सर?
नहीं कोई दिक्कत नहीं है. आप अपना आरसी से अपना रेफरेंस लेटर ले जाइए और
जी
वो
सर.
अपना स्कूल अगर एग्री करता है, ठीक
हाँ
है,
सर.
कोई
सर
प्रॉब्लम.
स्कूल में तो बात हो चुकी है प्रिंसिपल से और ईवीजीसी दोनों से.
हाँ तो बस ठीक है, आप कर सकते हैं, बिल्कुल कर सकते हैं.
ओके सर, ओके, थैंक यू सर.
Sir,
ओके.
can we do in the private schools?
प्राइवेट स्कूल में बिल्कुल कर सकते हैं आप.
Uh,
इफ द
uh,
स्कूल इज लाइक परमिट्स यू.
हम्म. तो कोई
हेलो
सब
सर।
प्राइवेट स्कूल में भी करते हैं, तो इज देयर एनी कंडीशन कि वो मतलब फुलफिल होनी चाहिए, देन ओनली वी कैन डू?
सी आप प्राइवेट स्कूल में कर रहे हैं तो आप ये चीज इंश्योर कर लें द काउंसलर हैव मीटिंग द बेसिक एलिजिबिलिटी क्राइटेरिया.
ओके सर, ओके.
ओके.
हाँ जी.
सर एक क्वेश्चन तो मेरा भी है.
हाँ हाँ बताइए.
सर मैंने ना अभी सेकेंड ईयर में प्रोजेक्ट चूज नहीं किया है, बट आई वांट टू डू पीएचडी इन दिस फील्ड. सो
Okay.
क्या मैंडेट सर, इज इट कंपल्सरी टू हैव अ प्रोजेक्ट इन मास्टर्स डिग्री फॉर द पीएचडी?
No, it is not mandatory, but if you do a project at master's level, definitely it will give you that insight how you are going further in PhD. Because मास्टर्स लेवल पे जो हम लोग प्रोजेक्ट करते हैं वो बेसिकली एक बहुत ही छोटा सा फॉर्म है रिसर्च करने का. एंड इफ यू डन वेल इन दैट प्रोजेक्ट, डेफिनेटली जब आप पीएचडी करेंगे तो ये एक्सपीरियंस आपको बहुत हेल्प करेगा.
थैंक यू.
Excuse
Good
me.
morning, sir.
गुड मॉर्निंग.
So, one quick question in terms of internship. Now that we have completed the internship, we recently got a mail that we are supposed to submit it online by 31st May. So I just wanted to ask, when is it that we can get it signed by you, since it says it needs to be signed by the academic counselor before submission?
राइट.
So when is it that we can get it signed?
बच्चे, I'll let you know. You can
All
just,
right, sir.
you can drop me a message. I'll share my number in this. Okay.
Sure, sir. Thank you so much.
If you need anything, any help regarding the internship project and all, so you can just ask me directly on my number.
Yes, sir. Thank you so much, sir.
I've shared my number as well as I'm sharing my email ID also.
That'll be great help. Thanks a lot, sir.
So please, yes, got it?
Yes, sir. Received.
Okay.
Excuse me, sir.
Yes.
सर जैसे हमने अपनी इंटर्नशिप कंप्लीट की प्राइवेट हॉस्पिटल से, बट जो टेस्टिंग या वो जो डायग्नोसिस वगैरह जो करते हैं वहाँ पे वो क्लाइंट बैठने के लिए अलाउ नहीं करते हैं. लाइक
Right.
रिपोर्ट वो सब नहीं किया है हमने. लाइक उनसे बात करिए, हिस्ट्री वगैरह टेक वो सब हमने लिया है, बट टेस्ट वगैरह पे नहीं किया. तो सर उसमें मतलब कोई प्रॉब्लम होगा?
नहीं, ऐसा तो कोई प्रॉब्लम नहीं होना चाहिए, बट
ओके.
कोशिश करिए दैट यू विल gain a very good experience from where you are doing internship. Okay.
ओके, थैंक
Choose wisely.
मतलब इन काउंसलिंग में बहुत मुश्किल से मतलब काउंसलर में मिलना थोड़ा डिफिकल्ट होता है कि आप वो क्लाइंट से बात करने दें या उस चीज में क्लाइंट ज्यादातर अलाउ नहीं करते हैं।
राइट राइट राइट। ठीक है, then we'll see in the next class.
Sir, about attendance.
Attendance, I think your attendance will be marked, or somebody will take the initiative to make a Excel sheet. That will be great.
एक्सक्यूज मी सर।
Yes.
सर एक और चीज पूछनी थी कि अगर हमें आरसी से रेफरेंस लेटर मिल गया है तो उसका कोई क्राइटेरिया है कि विद इन 6 मंथ या विद इन 8 मंथ्स हमें वो कंप्लीट करना है? सपोज जैसे मैंने फरवरी में आरसी से रेफरेंस लेटर ले लिया, बट जिस हॉस्पिटल में मुझे करना है वहाँ अभी डॉक्टर्स कह रहे हैं कि पहले आप थोड़ी सी नॉलेज गेन करके आओ, थोड़ी स्टडीज करके आओ, तो आई थिंक इट विल टेक टाइम। तो ऐसा कोई क्राइटेरिया है वहाँ पर?
नहीं नहीं, ऐसा तो कोई क्राइटेरिया शायद नहीं है। आप फिर भी आप एक बार अपनी जो बुकलेट है इंटर्नशिप वाली वो आप एक बार देख लीजिएगा।
ओके ओके सर, थैंक यू।
Okay, I hope everything will be clear about the first model of the introduction of the counseling process.
Yes, sir.
Yes sir,
Okay,
yes sir, thank you so
thank
much
you.
sir.
Thank you, sir.
Thank you sir.